So anyone who's been kind of paying attention to the media lately has perhaps seen indications of both increases in frequency, but as well complexity and severity of different types of violence. And there's been a lot coming out. The volume is actually quite frightening. And I think it's also been a bit demoralizing for people who work in this area because they've, worked really hard to make kind of small gains over the last years. So I want to talk about the research, as Megan mentioned, but first, perhaps two kind of framing points. And I think the first point is that given the information we have, it's really hard to say what kind of the magnitude and dynamics are that's actually going on. So I'll come back to this because I think it's really important to know that sort of calls to helplines and police reports give us a really imperfect picture of what's actually happening inside the home. And secondly, I think more generally, it's important to remember that COVID is not sort of the underlying cause of violence, right? So it may be intensifying or magnifying different risk factors, but we're kind of experiencing this unprecedented shock. But in reality, in many settings, these risk factors already exist, and violence is already normalized and a huge problem. So this is driven, of course, by underlying gender inequalities and power dynamics. And I think that framing is important to keep in mind when we're thinking about pathways and certain solutions in the COVID setting. So even though we're in this kind of new evolving situation, as Megan mentioned, we do have research to draw on. And I had the pleasure of leading an interdisciplinary group to conduct a review of pandemics and the effects on violence against women and children. And this was released last week on the CGD website. So you can go and kind of look at that and look at all the details. But what I wanted to do is kind of talk you through the main results. So what we try to do in the paper is essentially three things. So first we look at public health emergencies, other pandemics, economic crises, disasters, and we try and say, okay, what does the literature say about these potential pathways that might be playing out? Second, we look at kind of the prevention literature according to the different pathways we do find and say what could possibly be done in diverse pandemic settings. And then third, we discuss a potential research agenda going forward. So the first thing I want to talk about, and hopefully I can make my screen share work here, you should see a lovely graphic coming up, is the 9 pathways we found. So this was kind of the first thing we looked into. And I'm not going to talk through all of the different pathways, but I just wanted to highlight 3 of them. So the first I wanted to talk about is the economic insecurity and poverty-related stress pathway, and that's at the very top. And we know there's a large body of literature linking economic factors, including poverty, housing insecurity, food insecurity, unemployment, and there are negative associated coping strategies to violence against women and children. We already know the economic effects of COVID are going to be severe and they're going to be long-lasting, and this really has serious implications for many types of violence, including intimate partner violence and child maltreatment. So the second pathway I wanted to touch on is the second, which is the quarantines and social isolation pathway. So there is a systematic review evidence linking sort of quarantines to poor mental health and mental disorders, increases in stress, as well as simply kind of more day-to-day exposure to potential perpetrators. We also know that social isolation is a well-established tactic that perpetrators use to control survivors, so sort of social distancing in general may exacerbate this dynamic. And we also know that parenting may be particularly challenging under kind of close quarters and unusual stressful circumstances, and this might lead to higher rates of child maltreatment or violent discipline. And the last pathway I just want to touch on is number 4, which is exposure to exploitative relationships due to changing demographics. And this is the idea that, within areas where there's increased mortality and morbidity, this may leave children without stable care situations, and especially adolescent girls or widows who might be affected could be vulnerable to exploitation. And we've seen this come out quite strongly from the literature around the Ebola epidemic and the HIV pandemic. So I wanted to touch on that fourth one because I think that it's important that we also take kind of a longer view in thinking about how some of these pathways might play out, even though we are, of course, very concerned about the immediate response. So these pathways aren't, of course, exhaustive, but they were the ones that we found kind of the largest body of rigorous literature supporting them. And of course, they might interact with each other. And this is all to say, of course, that we believe that there is quite a potential and a risk for heightened diverse forms of violence. And I just wanted to pull out two of the quotes from the paper kind of to illustrate some of these pathways. So the first quote you see with the white background is a female beneficiary of a cash transfer program in Turkey. And she's talking about kind of the economic insecurity pathway and how for poor, fights come from this kind of suffering of being poor. And then the quote in the blue background is a pathway that I didn't have time to touch on, but it's the idea that there could be increases in both kind of frequency and severity of violence because of a lack of health sector ability to respond, paired with, of course, the potential for reduced help seeking because of fears of catching the virus. And this quote is from the National Domestic Violence Hotline in the United States, talking about a helpline call where a woman is scared to go to the ER because of fears around catching COVID-19. So what can we do? Of course, this is very important, and I think there are a number of different policy responses. We try to talk about 8 of these in the paper following different pathways, and I won't read all of these, but of course there's a lot of more information in the working paper, in addition to a compilation of kind of operational guides and implementation tools that we put in the annex. But these kind of potential responses include things like expanding and reinforcing economic social safety nets, expanding shelter and safe temporary housing for survivors, and encouraging informal or virtual social support networks. And I think it is quite promising to see that there have been some governments who have responded in kind of numerous different innovative ways, including, for example, Canada, Italy, France, and Australia have been kind of first movers trying to propose innovative solutions. However, I do also worry that kind of in the places where this might be needed the most, many of these options may not be possible or feasible, and many of the basic services may not even exist. So last I wanted to kind of talk about a potential research agenda going forward so that we won't be flying blind next time. And here we kind of group these into 3 different buckets. So first is simply understanding the magnitude of the problem. So in reality, as I alluded to previously, we actually have little understanding of how diverse forms of violence might play out during a pandemic and what subgroups might be most at risk. And so I want to give you 2 kind of anecdotes to illustrate this. And first is the issue that, you know, even in the best of times, we know that less than 7% of women seek formal help from combined health, legal, and social services. So you can see that kind of this is really the tip of the iceberg that we're seeing right now. And the second kind of anecdote is that we are actually seeing decreases in reports of some forms of violence. For example, child maltreatment, which is often triggered through education systems that are no longer functioning. So we really need to know kind of more just in general, what is going on, what is the magnitude of the problem. The second thing I think we need to do is we need better information on mechanisms and how they might play out in different contextual settings. And the third thing we need to know more about, of course, is what works. So including what works in the medium, short, and long term, and how cost effective these response options might be. And I know that it has been quite encouraging to see all the rapid data collection being done to inform the COVID-19 response. However, I do also want to caution that collecting this type of data on violence against women or children is quite ethically complex. So even in a non-crisis situation, right, it needs to be done very intentionally and carefully. That said, I think there are many ongoing studies that are focused on violence prevention already that are well positioned to tackle these questions going forward. So I think I'm hopeful that we will be able to both fill some of these gaps going forward and kind of use this crisis as a way to shine a light on violence in general and the need for more prevention efforts.